He was not moving. His face was, the first thing that concerned me is his face was like smushed into the ground, appearing swollen to me.
And, at that point, are you acting a little bit as Genevieve Hansen, EMT?
I identified myself right away because I noticed that he needed medical attention. It didn't take me long to realize that he had an altered level of consciousness, and in our training, that is when the first sign that somebody needs medical attention. So my attention moved from Mr. Floyd to how can I gain access to this patient and give him medical attention or direct the officers. And I didn't pay much attention to George Floyd after that.
So when you first got there and you saw Mr. Floyd on the ground, you mentioned about seeing his face, correct?
Correct.
And incidentally, I think in a subsequent interview you had talked about Mr. Floyd's face facing towards the speedway, correct?
Correct.
And
which is just what my memory did, but we know that's not right.
And now as you sit here today, do you remember seeing his face when you were around to the squad car side of him?
Yes, sir.
All right. And so in terms of, his face when you're first there, or even the rest of him, what is it that you saw that made you concerned about his medical needs?
I was really concerned I thought his face looked puffy and swollen, which would happen if you were putting a grown man's weight on someone's neck. I noticed some fluid coming from what looked like George Floyd's body, and in a lot of cases we see a patient release their bladder when they die. I can't tell you exactly where the fluid was coming from, but that's where my mind went. He wasn't moving. He was being restrained, but he wasn't moving.
When you first arrived, was he vocalizing at all? Was he speaking at all?
I don't remember.
And earlier you used the term altered consciousness.
Mm-hmm.
Yes?
Yes.
And what do you mean by that? What did you see in terms of his consciousness?
Well, when we're assessing on a level of consciousness on a call, we'll often first try to just talk to the patient and see if they respond. And if we don't get a response, we'll often kind of tap them on the shoulder or apply sort of painful stimuli. And often I would do a sternal rub or, press their fingernail very hard. And if they respond to that, we know that, we can assess their level of consciousness based on that. When somebody's laying on your, or, leaning into your neck, that's painful stimuli. So I could tell that from the sidewalk.
Tell what?
That he had an altered level of consciousness to the point that he wasn't responding to painful stimuli.
You mentioned that Mr. Chauvin had a knee on Mr. Floyd's neck.
Correct.
Did you see where his other leg was?
I don't remember anymore, but I think I may have said something about it in previous.
Did you think it was on Mr. Floyd's back?
I don't know.
Okay. And in that moment, when you first arrived and observed what you could about Mr. Floyd, what did you think you needed to do?
I think I had already assessed that he had an altered level of consciousness. What I needed to know is whether or not he had a pulse anymore.
And, I may back you up just a little bit here, but did you try and assess, how much weight Mr. Chauvin was putting on George Floyd?
I mean, I didn't try to. I recognized that it was an issue right away because he seemed very comfortable. With
Who's he?
Officer Chauvin.
Okay.
Seemed very comfortable with the majority of his weight balanced on top of Mr. Floyd's neck. In my memory, he had his hand in his pocket. He looked so comfortable.
And if his hand wasn't actually in his pocket, would that change anything that you obsessed at the time?
I suppose not. He was comfortable in the position that he was in.
So if his hand, instead of being in his pocket, was simply resting on his thigh, would that change any of your assessment?
He wasn't distributing the weight out and on the car, on the pavement.
When you first approached, you said you identified yourself as a firefighter.
Correct.
To whom did you identify yourself?
To Officer Tao, controlling the scene. I spoke loudly enough that I would think that the other three officers would have been able to hear me throughout the event.
And we know you weren't, well, let me ask you this way. How did Officer Tao respond?
He said something along the lines of, if you really are a Minneapolis firefighter, you would know better than to get involved.
What did you think of that?
First, I was worried that he wasn't going to believe me and not let me help. And I also, that's not right. I mean, that's exactly what I should have done. There was no medical assistance on scene, and I got there and I could have given medical assistance. That's exactly what I should have done.
So based on your training and experience and what you had seen, what did you want to do for this person on the ground?
Had they let me into the scene, I already had decided what his level of consciousness was, so I would have requested additional help. I would have wanted someone to call 911 for the paramedics and fire to come. I would have asked someone to run to the gas station and look for an AED. And I would have checked his airway. I would have been worried about a spinal cord injury because he had so much weight on his neck. I would have opened his airway to check if there were any obstructions. And I would have checked for a pulse. And when I didn't find a pulse, if that was the case, I would have started compressions. And I didn't have my bed bag, so I would have continued compressions. We don't give mouth to mouth anymore. So I would have continued compressions at a rate of 100 a minute until help arrived.
And by compressions, what do you mean?
I would have put my hands, stacked my hands and pressed his chest.
Chest compressions.
Chest compressions,
Yep.
correct, yeah.
And what's the point of doing chest compressions?
Pumping the blood for somebody that's not doing that themselves, trying to get a pulse back.
And were you able to do that, any of those steps?
No, sir.
Why weren't you able to do any of that?
Because the officers didn't let me in to the scene. I also offered, in my memory, to walk them through it, or told them, if he doesn't have a pulse, you need to start compressions, and that wasn't done either.
And so are these things that you wanted to do?
It's what I would have done for anybody.
And when you couldn't do that, how did that make you feel?
Totally distressed.
Were you frustrated?
Yes.
Ms. Hanson, as I told you, we can take our time, so feel free to just take a minute.